Just gonna have you take a deep breath in through your nose and out through your mouth. Okay, I'm going to put your hair up so that I can take a look at your spine. It did say in your file that you're having some neck and spine pain. I'm going to start with an anti-inflammatory essential oil. Just gonna have you take a deep breath in through your nose and out through your mouth. Just going to slowly palpate your spine. We're looking for any deviations of the upper cervical curvature and any spine immobility. Doing a physical assessment of the spine to check for any inflammation that could trigger an imbalance. The cervical spine is not that tight, but as we're going to the thoracic, there's a lot of soft tissue tightness around the spine. And even some fluid buildup right here at T2 and T3. Slight deviation of the spine towards the right axis. and listen to your back and your spine. It's just gonna feel a little bit cold. Sometimes we could hear some micro movements that are coming from the blood vessels being obstructed. That usually is from just a little bit of tightness and inflammation. Not a lot of movement, which is a good thing. I'm gonna go ahead and put gloves on. These measurements are going to determine if we're having an imbalance or looking for asymmetries, or checking every muscle movement. Slight fluid built up on the right cervical spine. I'm going to take a few measurements. We're looking for any neuroconductive divergence, and we want to make sure that we're locating the heat disturbances so that we figure out exactly which points we need to target with this therapy. Going to do a few tests here. I'm going to touch you with two textures. One is going to feel sharp, the other one's going to be dull. This is what dull is going to feel like. This is what sharp is going to feel like. So I'm going to be focusing on the main points of trigger that we need to focus on today's session. So we have here C3 and C4. T3, T4, T5, T7, and T9. Okay, go ahead and tell me if you feel this sharp or dull. sharp, dull. Okay, I'm going to create a vibration sound and I'll put it right on these main points. I'm gonna need you to tell me when you don't hear it anymore or you don't feel the vibration anymore. So go ahead and say now when you don't feel it. Okay, so really just the main point is it's T9. Okay. So I'm going to tap on these points. Go ahead and tell me if you feel pressure or sensitivity. 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 Pressure. 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 Sensitivity. I'm going to check for skin sensitivity. This is going to feel very light, gentle. We're looking for any elevations, changes in skin texture. Applying a conductory serum, I'm going to check for any abnormalities in the nerve endings. It's going to feel a little bit cold. So first we need to desensitize the area. Okay, now go ahead and tell me what shape you feel that I'm drawing. It could be a number or it could be a letter. do the same thing on the right side. Okay. Now I'm going to draw shapes or numbers.
D. B.
That's okay. All right, I'm just gonna go ahead and clean this for you. We're going to start with a micro adjustment. This does it creates a slight movement, just enough for the vertebrae to start shifting and create a little bit more space. I'm going to do skin pulling therapy. It helps to boost circulation in the area. I'm going to apply an anti-inflammatory oil. It's going to help boost circulation. And we're doing some cupping therapy along the paraspinal muscles to help us stimulate blood flow and release any toxins that have been accumulating. This is going to help to stimulate blood flow to the connective tissue. It's gonna redirect the impulses right to those main points that we try to target and increase the mobility in. feel a little bit cold. It also helps to stimulate blood flow and trigger those main pressure points so that we increase circulation. To do a micro adjustment. And now that the connective tissue has warmed up, this definitely feels less tight than it did at the beginning of the session. I'm going to have you take a deep breath in through your nose and out through your mouth. Good. Okay, go ahead and take another deep breath in through your nose and out through your mouth. Good. Good. Sharp. Tall. Tall. What about now? Sharp. 2. No. Left. Hi, Andrea.
Hi.
I'm Dr. Matt. I'm going to do your annual checkup today.
Nice to meet you.
Nice to meet you too. May I please have your last name and your date of birth?
Miller. Date of birth is December 7th, 1982.
Perfect. Do you have any allergies?
I do not.
Okay. Are you taking any medications on a daily basis?
Just vitamins.
And when was your last checkup?
About 6 months ago.
Okay. Are you experiencing any pain at the moment?
I do have headaches once in a while,
Okay.
especially on the back of my head.
And are they constant or they come and go?
They come and go.
And you said it's been going on like this for a month, right?
Yes.
Okay. Are you taking any medicine for this sometimes?
I do take ibuprofen once in a while, but I try not to that much.
Have you had any surgeries or any accidents in the last 12 months? Okay. any family history of headaches or neurological disorders?
Yes, my mom has migraines.
Okay. And do you remember when she was diagnosed with that?
Oh, a long while ago when I was little.
Okay. All right. We're going to go ahead and take your vital signs and do a checkup to see exactly what is triggering your headaches.
Okay.
I'm going to have you just take the blood pressure. This is going to go over your arm. Let's go ahead and use that one. Yeah. Okay, go ahead and relax. All right, I'm going to have you relax. Blood pressure is a little bit on the low side, 95/60. Are you feeling
I always
okay?
had it on the low side.
Okay. I'm going to take your temperature. It's going to go over your forehead. 98.7. That's perfect. Just going to go on your finger. It's going to measure your oxygen and your heart rate. That's perfect. And the oxygenation is 95% on room air. Perfect. Okay. Okay, I'm gonna put gloves on and I'll do an eye examination. Sometimes headaches can be triggered by vision changes that are not expected. So we're gonna do an ocular reflex test. I'm gonna have you look straight right here in my nose. Just try not to blink. Good. Good. So that's normal. Okay, go ahead and look straight at my nose. I'm gonna flash a light in your eyes. We're just looking for pupil dilation and constriction. Okay, just gonna lower on your eyelid a tiny bit, just looking for any redness. Go ahead and look up. Okay. All right, I'm gonna have you follow the light with your eyes only. Don't move your head. Okay, now I'm going to bring the pen light very close to your nose. I'm going to have you follow the tip of the pen light. One more time. Okay. Now I'm going to have you look right over here, a little bit higher. And same thing on this side. No ocular movements, that's good. Okay, I'm gonna have you change into a gown and I'll have you lay down on the table and we'll do a full body exam. Okay. Okay, Andrea, I'm gonna go ahead and first examine your face. So we're looking at the main muscle points that could trigger a tension in the scalp and neck area. And that's some of the most common causes for headaches. Are you experiencing any pain with chewing?
No.
Just slowly palpating the sinuses in between your eyebrows. Looking for any tension, fluid buildup, tenderness. Okay, checking sinuses right under your eyes. I'm not noticing any fluid buildup. Checking lymph nodes for any lymphadenopathy. Looking at pre and post auricular lymph nodes. Supplemental lymph nodes. Sublingual lymph nodes. Checking trachea to see if it is midline or any deviations to the right or left of the axis. Palpating the thyroid gland for any nodules or swollen. I'm gonna have you swallow one time. Perfect. Checking supraclavicular lymph nodes for anything swollen. Checking mastoid bone for signs of mastoiditis. I'm just going to gently press down on your TMJ. I'm going to have you slowly open your mouth all the way up, all the way, a little bit more. Just a little bit of clicking there. Go ahead and slowly close it. And I'll have you do that one more time. Slowly open, on the left side, right side. They're both clicks. Go ahead and close. Okay. I'm going to run an MRI after this to check for any cartilage deterioration, to see what grade of disorder we have. It could be from 1 to 4, 4 being the worst. But since you're not having any pain yet, I would say it should be like a 2, and it's right on time. We can definitely treat this. I'm gonna have you keep your eyes closed and tell me what this smells like. I'm gonna close your right ear. And I'll have you breathe in through your nose and out. Are you able to identify this smell?
No.
Okay. Let's go ahead and check the right ear now. I'll have you breathe in and breathe out. What does that smell like?
Alcohol?
Okay. Go ahead and check your taste. Have you noticed any changes?
No.
Okay. This is gonna go on the tip of your tongue. I'm gonna have you open and taste. Go ahead and close. Open. What does that taste like?
I don't feel any taste.
Okay. Let's go ahead and try one more. Go ahead and open. Close. And open. What does that taste like?
Still nothing.
Okay. So let's go ahead and check your facial sensation. I'm going to touch you with 2 textures. The one is going to feel dull, and the other one's going to be sharp. This is what dull is going to feel like, and this is what sharp is going to be like. Okay. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp.
Does this feel the same as this?
Yes.
And does this feel the same as this?
No.
Does this feel the same as this?
No.
Does this feel the same as this?
Yes.
Okay, so that looks good. I'm gonna go ahead and check your scalp to see if there is any asymmetry or any skin abnormality. So first we're palpating to see if there are any lumps or bumps and checking for skull base symmetry. I'm going to turn your head to the right. I'm going to listen to your heart. Is it okay if I slide the stethoscope under the gown? Sure. Okay. I can hear only S1 and S2. No S3, no S4. I'm gonna have you take a deep breath in through your nose and exhale. Okay. I'm gonna check for murmurs. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Checking for any jugular vein distension. I'm not listening to any bruit, no signs of heart failure. All right. Scalp is on the dry side. Noticing a little bit of yellow discoloration and drier patches. I'm going to do a sensory test to see if there is any sensation loss on the left side. Go ahead and tell me if this feels dull or sharp.
Dull.
Was that sharp or dull?
Dull.
What about now?
Sharp. Sharp. Dull. Dull. Sharp.
Do you feel this dull all the way down?
Yes.
Go ahead and tell me how many taps you feel. 1, 2, or 3.
2. 2. 2. 1. 2, 1.
Okay, does this feel sharp or dull?
Dull.
What about now?
Sharp.
And now?
Sharp. Sharp. Sharp.
Okay, gonna have you turn your head to the left. To apply a basic solution, it's gonna help to remove the dry skin cells. We're gonna make sure that we distribute this solution to the area that we want to collect the cells. This is a sterile cotton swab. We're going to collect what we were able to extract. going to send this to the lab. It's going to take about 24 to 48 hours that we get the results, and I'll let you know. Okay, I'm going to check your hearing now. So we want to see if there is any discrepancy between left and right. I'm going to create a tuning fork sound. Go ahead and tell me when you don't hear this sound anymore. You can just say now.
No.
Okay.
No.
Okay. Now go ahead and tell me if you hear which sound you hear louder. Position 1 or 2.
2.
Same thing on this side. Position 1 or 2.
2.
Okay. Now tell me with which ear you hear this sound, left or right.
Right. Right. Left. Left. Both. Both. Right. Left. Left. Right.
Okay, wonderful. So there is no impaction on the hearing, no hearing loss. I'm going to go ahead and check your abdomen, and let's see if there's any pain there. Starting with the left lower quadrant. Normal vowel sounds. I'm not noticing any hyperactivity. I'm going to slowly percuss. Let me know if you feel any type of pain. just a very slow palpation. Let me know if you feel any pain. We're looking for tension, rebound tenderness, and any swollen organs. Liver size is normal. Okay, perfect. No tenderness around the umbilicus area. I'm not seeing any redness. So no signs of peritonitis. Alright, I'm just gonna go ahead and lower the gown. Okay, so just slowly palpating to see if there is any asymmetry. Also looking at temperature. And if we're noticing any peripheral edema, especially looking around the ankles. Okay, I'm not noticing any diaphoresis, no swollen glands. Okay, pedal pulses are strong, 2+. Go ahead and tell me if you feel this vibration.
I do.
Okay. What about now?
I do.
Right. Go ahead and tell me when it stops.
It stopped. Stopped.
Okay. Going to take a few measurements. Just gonna have you lift this up and relax. 65. Gonna have you lift up and relax. Good. We're going to go ahead and check your reflexes. Okay, go ahead and relax your foot. Good. Relax. Good. Okay, I'm just gonna bend this knee over your left leg, just like that. Good. Okay. Same thing on the other side. This needs to be dangling just a little bit more. Okay, perfect. Okay. Let's check your Babinski reflex. Go ahead and relax. Just gonna feel a little bit of sharpness on the sole of your feet. Good. Okay, perfect. I'm going to check the strength of your legs. gonna have you pull your feet towards you and as strong as you can. Okay, perfect. I'm gonna have you push in with your pads. Good. I'm going to slide my hands under your heels. Okay, I'm gonna have you push. Okay, a little bit stronger on the right side, but that's normal. All right, I'm gonna try to open your legs. Don't let me do that. Good. I'm gonna try to close them. Don't let me do that. Okay, perfect. And now I'm gonna try to push down while you're pushing up. Okay, good. Okay, a little bit weaker on the left side. I'm gonna have you tell me if you feel this all the way up.
I do.
Okay. And do you feel this all the way up?
Yes.
Okay. Does this feel the same as this?
Yes.
Okay. Do you feel this vibration?
Yes.
Tell me when it stops.
I do.
Okay. Same thing. Tell me when it stops.
Stopped.
Good. Okay. Very normal results. I'm gonna have you flip over now and I'll take a look at your back. Okay, to listen to your lungs. I'm gonna have you take a deep breath in through your nose and slowly exhale. And again, breathe in and breathe out. No signs of pulmonary edema. I'm going to percuss. I'm going to palpate cervical spine, starting with atlas, moving down to axis, C3 and C4. Looking for any deviation of the spine to the left or right. No signs of scoliosis or lordosis. I'm going to check skin turgor. This helps to determine if there is good hydration and nutrition. again. I'm going to take a few measurements. We're checking for asymmetry. Okay, this is gonna feel like a benching sensation. Checking for skin darker again, and any asymmetry in the left or right. The right side definitely looks better. I'm going to check your neurological responses. I'm looking for any internal deficits. I'm not noticing any abnormal responses. I'm going to draw a letter on your back. Go ahead and tell me if you can identify it.
N. B. C. Z. M. D. R.
Okay, perfect. I'll have you sit back up on the table and we'll do one last checkup. going to check your reflexes. So what I'm going to do is I'll slowly tap on your chin. I'm going to have you relax. Relax your chin a little bit more. Slightly open. Good, there you go. Okay. All right, I'm going to have you relax your arm. Okay, a little bit diminished on that side. Go ahead and relax. I'm going to have you flop it like this. Good. Good. Relax. Okay. Good. Okay. Okay. All right, now I'm going to have you put your arms in front of you, just like that. So I'm going to have you squeeze my fingers as strong as you can. Okay, good, bilaterally. I'm going to push down on your arms. Don't let me do that. Good. Now I'm going to try to push them up, but don't let me do that. Okay, weaker on the left side. I'm going to try to open them. Don't let me do that. And close. Okay, I'm going to have you spread your fingers out like that. I'm going to try to close them. Don't let me do that. Good. Spread them out. Okay. Okay, good. Go ahead and relax. I'm going to have you shrug your shoulders like this. Good. And now I'm just going to press on this side of your cheek and I'm going to have you resist. Okay. Good. Same thing on the other side. All right. I'm going to have you look down. Okay. Good. All right, Andrea. Everything looks good. I'm just going to run an MRI to see exactly how your TMJ looks. Okay. And I think that's where your headaches are coming from. I'm going to write all of this in your chart. So I'm going to make a new file for you and make sure that we have this information ready for the next checkup. Okay. And I will give you a call back with the results from the MRI, okay?
Great, thank you.
You're welcome. Very nice to meet you.
Likewise. Thank you.
Hi, Angelina.
Hello.
Thanks for coming in.
Thanks for having me.
Absolutely. So, you're having some more back pain.
Mm-hmm.
Go ahead and tell me, how long has this been going on?
So this has been going on for the past few weeks. I've kind of been feeling some pain up in my upper shoulders and then also like within my lower back as well.
Okay. Have you noticed any rashes or itching?
No.
Okay. Have you been traveling outside the country lately?
Mm.
Any injuries to the back, to the shoulders, the head?
Not recently, but I had injuries a few years ago.
Okay. And tell me more about it.
I was in gymnastics and I had landed on my neck, and ever since that injury, I've had some back pain.
Okay. And are you noticing any indigestion or any cramping, especially before your period?
Yeah, I have noticed some cramping, but everything else has been normal.
Okay. And is that something new or something that has been going on after the accident?
I wouldn't say it's new.
Okay. And do you remember if you were having the same symptoms before the accident?
Yeah.
Okay. So that must be something that is related to your normal cycle. Any numbness around the back or down the fingers?
No, it's never down the fingers or anything like that.
Okay. Have you noticed any increase in headaches?
Yeah, I've noticed an increase in headaches, and then also the back of my neck does tend to get sore at times.
Okay. All right. We can definitely take a look and see how the alignment looks. And one last question. Are you having any pain down your back going to the sole of your foot?
No.
Okay. So we're going to check for sciatica too, just to rule out and make sure that there's nothing imbalanced in the hips. and we're going to look at the cervical spine and see how that feels. Okay, so go ahead and stand up for me. Okay, so go ahead and take a few steps towards me. Okay, turn around. Keep walking. Just looking at the gate and how you place your feet. Go ahead and come back on the mat. All right, keep walking towards me. I'm going to have you turn around. Let's take a look at your back now. Okay, I'm going to feel my fingers just pressing down on the spine. This is where the pain is located, right?
Yeah.
Okay, as I'm pressing down, I'm going to have you try to touch with your left ear, your left shoulder. Okay, come back to center. And let's do that again on the right side. Okay, come back to center. Now go ahead and try to touch your chest with your chin. Okay, curve and curb your shoulders inside as you're doing that. Try to touch your chest, okay? Come back to center. Okay, just going to palpate trapezius muscle. And not feeling any increased tension here on the left side. Let's check right. Okay. Go ahead and lift your arm up. So we're going to do a 90-degree angle. Just going to slowly palpate around the shoulder area. And come back to center. Okay, now go ahead and move your arm away from your body. So basically we're testing different grip muscles to see exactly where the pain originates. Come back to center. So let's check the other side. Perfect. Any pain here?
No.
Okay, it does feel like there's a lot of tension, feeling a knot in the back of the acromion. Okay, now go ahead and come back to center, and we're gonna do the same thing. Okay, any pain here?
No, it's just a little tight.
Tight. Okay, we don't want that. Okay, come back to center. So, just going to slowly palpate around the spine. I'm just gonna move this. I cannot move it. It's okay. No, I'll just leave it. Okay. Just going to slowly palpate around the spine. Okay. Go ahead and relax your hand. I'm going to have you try to touch right here where I'm touching you right now. Okay, so I'm going to press down on your palm as you're trying to do that. Go ahead and tell me if you feel any pain anywhere.
Just near my shoulder blade.
Okay. Is it coming from here?
Just about there.
Okay. Just like I suspected. So there's an impinged nerve that we can definitely try to loosen up. Let's go ahead and check on the other side. So just let me find the spot. Okay, go ahead and try to touch right here. Perfect. Okay, a lot better mobility on this side. I'm going to do the same thing. So I'm going to tap. Any pain?
No.
Okay, just going to slowly press down. Any pain? Okay. Okay, checking your lumbar and sacral region.
It's a little sore there.
Okay, and is it moving down?
No.
It stays there. Okay. Okay, quite a movement here, so that's good. Okay, I'm gonna have you lay down and we're gonna start with a hip adjustment. Okay, so go ahead and put your arms around you like you're giving yourself a hug. I'm gonna have you scooch on your right hip. So turn your whole body. There you go. Now bend this knee up. There you go. And on the count of 3, I'm gonna have you take a deep breath in. 1, 2, 3. And breathe out. Good. So we'll do the same thing on the other side. I'm gonna have you scooch on your left hip. 1, 2, 3. Breathe in. Breathe out. Okay, perfect. So let's go ahead and check the length of your legs. Okay, so your right leg is actually shorter than the left one. And let's see how much movement is in this right leg. Okay. Okay. Just going to stretch these legs out a little bit. So we're going to make you a tiny bit taller. Take a deep breath in. Breathe out. Good. And again, breathe in. And breathe out. Okay. Go ahead and relax your feet. Okay. That's very good. Lots of movement in here. Okay. Let's go ahead and check your arms. Okay. Any pain as I'm pressing down here?
It's just a little sore.
Okay. Go ahead and take a deep breath in. Breathe out. Good. Okay, just slowly going to press down from the shoulder joint. Go ahead and take a deep breath in. Breathe out. Very good. Okay, let's take a look at your neck. Okay, I'm just going to palpate your neck. And before we do a neck alignment, I want to see if there are any adhesions that we need to loosen up. Okay. It does feel very tight, and I would like to work on these muscles before we do any adjustments. Is it okay if I lower the straps?
Yeah.
Okay. So we're just gonna go ahead and push these to the side, and I'm going to apply an anti-inflammatory oil. It has eucalyptus infusion. So I'm just going to apply it all over the trapezius muscle, going into the occipital muscle. I'm using the main pressure points to activate lymphatic drainage. Just trying to stretch these muscles and loosen up the adhesions that have been forming. This adjustment is going to help to increase mobility in the cervical area. I'm going to apply cold therapy. Go ahead and relax your neck. This helps to reduce inflammation. Okay, so let's go ahead and see how this feels now. Okay, a lot better. Well, I definitely feel more blood pumping through. It feels more mobile, softer. Okay, go ahead and take a deep breath in and breathe out. And again, breathe in and breathe out. Okay, perfect. I'm going to do a cranial adjustment as well. Try to find the meridians that help with muscle tension. Okay. Okay, I'm gonna have you move on your belly. I have here a nervous scope. It's going to help to register heat differences in the tissues along the spine. Okay, so we are currently at T1, T2. Just gonna move this a little bit to the side. Slight heat difference, I would say about 2-3 degrees at L1. Okay. So we're going to check lumbar and cervical connection. Just going to slowly palpate. Okay, the plexus looks a little bit inflamed on the right side. I'm going to see how the connection looks with cervical plexus. Okay. Go ahead and lift your left leg up. Good. Come back to center. Right leg. Come back to center. Left leg. Hold. Come back to center. Right leg. Up. Hold. Come back to center. Okay. Go ahead and take a deep breath in. Breathe out. Okay, go ahead and lift your legs up in a 90-degree angle, both of them. Very good. Take a deep breath in and hold it for 3 seconds, okay? And relax. Okay, we're going to do skin pulling. Okay. I'm going to do some shoulder adjustment. Breathe in, breathe out. I'm going to apply an anti-inflammatory oil. Just working on the sacral and lumbar region to soften the tissue. Creating some spaces in between the lumbar vertebrae. It's going to help with the lower back pain that you're having, especially after the accident. So it's going to increase circulation in this area, helping with any digestive problems. There's a lot of parasympathetic innervation that we're triggering right now, and that's going to help with all the main organs found in this area. Just going to slowly work on the lymphatic drainage from the hip region, moving the lymph down, just helping it to drain so that we are moving the fluid. This is a very gentle cupping. It helps to increase circulation. Sorry. Okay, I'm going to use acupressure to activate the plexus. Any pain as I'm doing this? Okay. Okay, activating the craniosacral region. Any pain in the shoulder still? Just gonna move your hair. And I'm going to palpate to massage the occipital area. I'm going to do a little bit of hair pulling. It helps to decrease tension in this area.